Down Syndrome by Addie Meek and Annabelle Knapp.
Odds of being affected. A woman's chances of having a baby diagnosed with Down syndrome increases the older she gets. The older the eggs, the harder it is to have proper chromosome division. Having one child with Down syndrome gives the mother a 1 in 100 chance of having another child with Down syndrome. If both parents are carriers of Down syndrome, the gene will be passed down onto their children.
Inheritance pattern. If both the mother and father are carriers, they can pass the gene for Down syndrome onto their children. Most causes of Down syndrome are not inherited. Trisomy 21 causes chromosomal formation to occur differently during the reduction of cells. The chromosomal abnormality takes place in the egg cell. However, it is occasionally found in the sperm cell. Non-disjunction, an abnormal number of chromosomes, results when there is an error in cell division. Down syndrome occurs when an extra chromosome 21 is inherited.
Description of chromosome disorder. The chromosomal condition results in facial appearance differences, intellectual disability, and weak muscles during infancy. About half of all newborns affected with Down syndrome are born with a heart defect or digestive abnormalities. However, digestive abnormalities are less common. People with Down syndrome have an increased risk of dealing with multiple medical conditions at the same time. Children with Down syndrome have often showed behavioral problems and delayed development. As people with Down syndrome age, there is a gradual decline in their ability to think. Also, they have an increased risk of developing Alzheimer's disease.
Is it a mutation? Down syndrome is not a genetic mutation. It is instead caused by a flaw in cell division. In the end result of cell division, an extra copy of chromosome 21 appears. Researchers found that more than 90% of Down syndrome cases came from the mother in the egg, 4% of Down syndrome cases came from the father in the sperm, and the rest of the cases formed when there was a fault during fertilization when the embryo was growing.
Does it affect an ethnic group or sex more than the other? Studies indicate that Down syndrome appears to be more common in the males rather than the females. Down syndrome is also seen more often during Hispanic childbirth. African American children appear to be less likely diagnosed with Down syndrome. The number of people with Down syndrome in the United States is more likely to increase in the future.
Signs and symptoms. Some signs and symptoms of Down syndrome include the following: low muscle tone, small ears, flexible joints, small nose with a flat bridge, upward slanted eyes, small hands and short fingers, deep crease along the center of palm, intellectual disability, heart defects, celiac disease, eye conditions, hearing problems, depression, ADHD, and autism.
Tests. Some tests that have been run on the mother of a Down syndrome child are: screening tests, show the mother if she is going to have a child with Down syndrome. Diagnostic tests, show whether or not your baby will have Down syndrome. Blood tests can show if the mother has abnormal levels that can indicate a problem with the baby. Ultrasounds can show if the baby has issues on the back of his neck. If the baby has more fluid on the back of their neck, they may have abnormality.
Treatments. There are a few symptoms that can be treated with Down syndrome. Some defects of Down syndrome can be helped with medication prescribed by a doctor. There is no way to prevent Down syndrome. It occurs during cell division, and there are no ways to take care of an accidental extra chromosome.
Prognosis. Prognosis for Down syndrome depends on how severe Down syndrome is for the children and adults. Life expectancy has increased over the years. In 1928, the average lifespan was 9 years old. To this day, people with Down syndrome live to 50 years and beyond. People with Down syndrome are living longer, meaningful lives. Some are even getting married.
Sources.